We're doing it. We have a process going on right now in Vermont that isn't happening in any other state in America, where our hospital executives, our providers, doctors, nurses, and healthcare providers are in a room together, in a process together with the Green Mountain Healthcare Board and all of us, moving the system from one that we can't afford to one that we can afford, that reimburses for quality instead of quantity. That's a big deal. So it's not as if this isn't happening. We're at it. We're doing it, and we're going to stay on it till we get it right.
But Governor, it seemed like what John Campbell was saying was that there's not just one way that health reform could look, and if what you're trying to do currently isn't working, maybe there should be another plan for how to reform healthcare in the state of Vermont. And
well, you've got to talk. I cannot sit here and explain what someone else said. You talk to John about
Do you
that.
think but is there only one way to reform healthcare in Vermont that will accomplish your goals, or are there others?
I think it's important for us to remember that when we talk about this issue, we're talking about a healthcare system that right now almost everybody who is working within it says is not sustainable. That's kind of a big deal here. You know, we're not talking about, as I've said before, the corner grocery store going out of business or the corner liquor store or the dry cleaner. I mean, that would be terrible, but you'd find somewhere else, you know, to get your dry cleaning done. We're talking about a healthcare system. Everyone collectively agrees, who's in the know, that we can't continue to sustain the system that we're paying for. So, you know, we're going to get this right. I personally believe that we have the prescription to get it right, and I believe we will collectively come to the same conclusion, that moving to a system where you spend less money for better quality and better outcomes, don't reward quality, reward quality, combined with a payment system where we all pay based on our ability to pay, is going to lead to prosperity and an affordable quality healthcare system for all.
Doesn't it concern you, though, that after 3 years of beating that drum, a Doyle survey of 13,000 people show that almost as many people think the state's on the wrong track as on the right track?
You know, I'm actually heartened to be the governor of a state where time and time again, Vermonters ask us to address the real obstacles to their prosperity and to their neighbors' prosperity. And that's the conversation we're having now. If anyone around this table thinks that this is going to be an easy conversation or that there are easy solutions, this can be figured out like that, you know, I would dissuade you from that. So there's going to be, you know, a lot of folks who are going to be working collectively to get this right. And I'm heartened to have the legislature that I do and the leadership that I do that I'm convinced will get it right with us, along with all the Vermonters that are helping us to pull it in the right direction.
Governor, there's about 30 House members that are hoping to amend the miscellaneous tax bill tomorrow to include a study of the revenue impact of legalizing marijuana based on the Colorado model. Is that something that you would support, to find out what the revenue impacts would be in Vermont if the state moves forward?
You know, this is what I've said about legalization of marijuana. Well, you know, I'm not timid about being a leader, not timid about having Vermont get it right first. I'm incredibly grateful to Governor Hickenlooper and to Governor Inslee in Washington and Colorado for trying to get this one right first. And I'm going to let them do their work. Now, for us to ask questions, try to figure out what it would mean to Vermont, I think that's all good. But as you know, most of us are grateful that Colorado and Washington State are pioneering.
So you would support that in the miscellaneous tax bill?
If the legislature thinks it's the right thing to do, it doesn't upset me. Sure.
Going back to Act 48, though, that law called on you to present some options to the legislature January 15th last year. You didn't do that. You said you were going to do it in March or April of this year. You decided not to do that. What is your reluctance to share with Vermonters what some of the financing options are for a single-payer system?
You know, I want to be very clear about this. I'm not reluctant to share anything with Vermonters. Anytime I think we have it right, I will be the first, as you know, to share it with every single Vermonter that's willing to help us. My problem is that we don't have it right yet. And one thing I've learned about healthcare reform in the last few months is better to get it right than to pick an arbitrary date, or in my case, have it picked for you, and have to meet it. So this is very important work. but I can assure you it's also has huge ramifications. Every time you think you've got the perfect solution, you drill down into it and find out you're leaving somebody out, or it has ramifications that you didn't consider when you first thought of it. So I've got a brilliant team working on it. The minute we have it right, we will share it with Vermonters to make sure that they think we have it right.
Is 2017 an arbitrary date?
Yeah,
Coming up.
you
Is
signed
27
Act 48, right? I mean, that was what the date was in, and then you also
Do
personally
you all
committed
really
earlier
want
this
to,
year.
I mean, I'm willing to retread the past. I'm more interested in the future. As you know, when we passed Act 48, I believed, as I said on Bob Kinzel's show and many others, that we could beat the federal requirement that no one moves to a single-payer system before 2017. That's what I believed when we signed Act 48. As you know, my folks in healthcare and a lot of others convinced me that I was dead wrong. So I admitted I was dead wrong, and now we're on the dead right path. Let's stick with it.
Governor, progress report on Vermont Health Connect. We have a deadline on Monday. Where does it stand? Are we ready? Do we have enough people signed up?
Two answers to that. First of all, I'm incredibly encouraged that Vermont has more people signed up per capita for the Affordable Care Act than any other state in the country, bar none, and by big numbers. So there are lots and lots of Vermonters who now have access to affordable health care they didn't have before. Having said that, if you're one of the smaller group who is still having trouble getting it right, it's incredibly frustrating. So our job is to not only celebrate the folks, the tens of thousands of folks who have now successfully navigated the website or signed up and have health insurance, but to get the smaller group of folks who still haven't gotten there and get them through the puzzle. What are we doing with that? Obviously, as you know, websites get better all the time, but we've gotten an exclusion from the feds to allow us to give us the time so that anyone who signed up but who's having technical problems, we're going to make sure that they don't lose coverage. So those are the two things that we're up to.
What are your impressions of Representative Heidi Sherman? You've worked with her for a number of years.
I'm always hesitant to comment on any of the 180 legislators. They're all great. They're like kids. You don't want to start talking about one because you hurt the feelings of the other.
Do you think she'd make a good governor?
Excuse me?
Do you think she'd make a good governor?
This is what I think about any questions about governors in Vermont. As you know, I'm a big believer in a 2-year term. A lot of former governors think that that's not very logical conclusion, but I enjoy the 2-year term. I love going out and talking to Vermonters, asking them whether we're on the right track. But I also recognize that if you have a 2-year term, my job is to focus on what Vermonters hired me to do, and that's create jobs, economic opportunities, and lead the state. So I put off any discussions about what next, who next, or why next until Labor Day or shortly thereafter. And I'd be happy to talk about it at that time, but what I'm going to do meanwhile is focus on my job of creating jobs.
So even though you've raised more than $1 million for your re-election campaign, you're not going to address the candidacy of someone who says she's considering running?
Again, I'm happy to talk about politics after Labor Day, but I'm going to focus on creating jobs and economic opportunities for Vermonters. We're getting results, but we got more work to do.
Governor, yesterday the representative said that she thought you were beatable, and that's why she was considering a run. Are you beatable?
Again, let's find that out on Election Day. And I think that, if I don't do my job, I, like any candidate, am beatable. So what I focus on is doing my job, creating jobs. We've created 11,000 new jobs in the state almost. I want to create more. I want to continue to meet the promises I made to voters, and I think they'll judge us on that. We can discuss it after Labor Day. Vermonters, I don't think, by and large, want any longer a campaign than I do. They want their governor doing their job, and I'm going to do my job.
You chose not to have her back here with the others. Does that mean you like the Senate bill better, or you just don't like Heidi involved, or?
She was invited, actually.
Okay.
You could.
Oh, you're getting in. You're above my.
Yeah, she's-
Governor, you said
You're above my pay grade.
You said 2017 was the earliest the state could go to single payer, but is that an arbitrary date as well? You said you're shying away from arbitrary dates in healthcare.
No, the only thing about 2017 date is, as you know, the federal bill precludes any state from going there before 2017. So obviously, I want to get it done as as quickly as I can.
But it doesn't have to be January
The
2017.
law doesn't say that, it just says you can't do it until.
But your priority.
My priority is to get it done as quickly as I can.
Thank you.
Thank you so much.